Most people don't realize this. Cancer doesn't just appear overnight. It's not like you wake up one day and suddenly have cancer. It's a slow process, one that can take years or even decades to develop silently in your body. And while this might sound frightening, there's a hidden opportunity here. Because if cancer grows slowly, that means there's time to recognize its signs, time to make changes, time to stop it before it spreads. The real tragedy is that most people ignore the early warnings. They dismiss the signals their body is desperately trying to send. They say, I'm just tired, or maybe I'm getting older, or it's probably nothing. But in reality, your body never lies. It always tells the truth. You just have to learn how to listen to it. You see, every symptom, even the smallest one, is your body's way of speaking to you. That lingering fatigue, that unexplained ache, that sudden change in appetite, these aren't random. They're like little red flags. Your body is trying to say, hey, something's not right here. But what do most of us do? We silence those signals with caffeine, with painkillers, with distractions. We push through the discomfort because life is busy and we don't have time to stop and think. But cancer doesn't wait. It takes advantage of your ignorance. It hides behind your excuses, and by the time most people finally pay attention, it's often too late. I want to make one thing clear. I'm not here to scare you. I'm here to empower you because knowledge is power. Awareness is your defense. Once you understand what's happening inside your body, you're no longer helpless. You can take control. You can make informed choices. You can prevent what others think is unpreventable. Cancer doesn't start as cancer. It starts as cell damage, small, microscopic errors in how your cells divide, repair, and communicate. And that damage comes from something. It could be chronic inflammation. It could be toxic foods, too much sugar, lack of sleep, emotional stress, or nutrient deficiencies. These things, over time, create an environment where healthy cells become damaged and rogue cells begin to multiply. The first major warning sign that often goes unnoticed is unexplained fatigue. This is not the kind of tiredness you feel after a long day at work or after missing a night's sleep. This is something deeper. You wake up tired, you go through your day tired, and no matter how much rest you get, you never feel recharged. Why? Because cancer cells feed on energy. They consume glucose, your body's main fuel, at an accelerated rate. They literally steal energy from your healthy cells. So even though you might be eating enough, your energy supply is being hijacked. Most people blame this kind of fatigue on age, stress, or lack of exercise. They drink more coffee, take vitamins, or push harder, thinking it will go away. But when your energy levels keep dropping and you can't find a reason, that's when you listen. It's your body's early cry for help. Chronic fatigue is one of the most common symptoms in many cancer patients before diagnosis, and yet it's often ignored for years. The key difference between ordinary tiredness and cancer-related fatigue is that normal tiredness improves with rest. Cancer-related fatigue doesn't. It lingers. It deepens. It's your body burning energy just to fight what's happening inside. Now, I want you to pause and think about something. When was the last time you truly listened to your body? Most people live disconnected from it. They treat symptoms like enemies to be defeated instead of messages to be decoded. Headaches, digestive issues, skin changes, mood swings. All of these are feedback mechanisms. Your body is not punishing you, it's guiding you. The real issue is that we've lost the ability to interpret its language. Cancer, in its earliest stages, often hides in plain sight. It doesn't cause obvious pain or dramatic symptoms. It starts with subtle imbalances, things that are easy to overlook. Maybe you've lost your appetite. Maybe you're more tired lately. Maybe you're getting sick more often. These are not random coincidences. These are early whispers. And if you start paying attention, you'll notice patterns. The body is beautifully designed. It always tries to heal, to restore balance, to survive. But when we keep ignoring the signals, it eventually gives up trying to whisper and begins to scream, and that's when disease becomes visible. The biggest mistake people make is waiting until something feels serious before taking action. By then, the damage is already deep. But if you catch it early, if you start by simply listening, you can change everything. You can adjust your lifestyle, improve your diet, strengthen your immune system, reduce inflammation, and create an environment where cancer simply can't thrive. So before we dive deeper into the 7 major signs, I want you to remember this foundational truth. Your body is not your enemy. It's your ally. It's always on your side, doing everything it can to protect you, to repair you, to warn you. And it's talking to you every single day through symptoms, through sensations, through signals. When you start treating those signs with respect instead of annoyance, you'll begin to understand the real meaning of prevention. Cancer doesn't appear suddenly. It develops silently, but it also communicates silently. It's up to you whether you want to hear the whispers now or face the screams later. Awareness isn't about fear, it's about empowerment. Because when you know what to look for, when you understand what your body is trying to say, you gain the most powerful tool there is: early detection. And that, my friend, can save your life. Now, let's go deeper into what your body is actually trying to tell you through these early signs. The first and perhaps most underestimated signal is chronic fatigue, when your body constantly feels drained. When no amount of rest seems enough, it's not simply tiredness, it's a biochemical cry for help. Fatigue from overwork or stress usually improves after good sleep, hydration, or nutrition. But cancer-related fatigue is different. It's constant, heavy, and unexplainable. It's the kind that follows you even into your mornings. It's not just mental exhaustion, it's physical energy being stolen from within. Here's what's happening. Cancer cells have an abnormally high metabolic rate. They multiply rapidly, and that requires massive amounts of glucose. These cells rob your healthy tissues of nutrients, oxygen, and fuel. So even though you're eating, even though you're resting, your energy isn't being restored because the resources are being redirected toward the disease. On top of that, your immune system, which constantly fights infections and maintains repair, is now on high alert, burning through your reserves trying to control abnormal cell growth. The result: deep, bone-level fatigue that doesn't improve with rest. Now, let's move to the second sign: unexplained weight loss. Imagine eating the same meals, living your usual routine, but suddenly your clothes start to feel loose. You're losing weight, but you haven't changed your habits. At first, you might think, that's good. Maybe my metabolism has improved. But this is where many people make a deadly mistake. Weight loss without effort, especially when you're not trying, is never normal. It's one of the earliest and most visible indicators that something's happening inside your metabolism that shouldn't be. Cancer cells alter how your body processes nutrients. They burn through calories at a faster rate and interfere with your digestive system's ability to absorb key vitamins, proteins, and fats. This metabolic chaos causes your body to lose both fat and muscle. The weight you're losing isn't healthy weight, it's your body being consumed from the inside out. Studies show that unexplained weight loss, even as little as 10 pounds without trying, can be an early warning sign of cancers such as pancreatic, stomach, lung, or esophageal. But most people dismiss it, thinking it's due to stress, appetite changes, or aging. When your body loses weight for no reason, it's telling you something is off in your chemistry and you need to look deeper. Get your blood tests done. Check your liver enzymes, blood sugar, and inflammation markers. Your body doesn't drop pounds randomly. It does it in response to an internal imbalance. Ignoring it doesn't make it go away. It allows it to progress. Now, the third sign: persistent pain. This is one of the most misunderstood and overlooked signals of all. A pain is your body's natural alarm system. It's the way your brain gets information that something needs attention. But what do most people do when they feel pain? They suppress it. They take pills, ignore it, or say it'll go away. Pain, especially when it's chronic or localized, is not something to overlook. There's a difference between temporary pain from an injury or workout and persistent pain that doesn't seem to have a reason. When pain lasts more than a few weeks or it worsens without clear cause, it's often because there's an underlying inflammatory or structural problem. In the case of cancer, pain may come from tumors pressing on nerves, bones, or organs. For example, back pain can sometimes be linked to pancreatic or spinal tumors. Headaches that don't respond to medication can signal neurological changes. Pelvic pain might indicate reproductive cancers. It's not about panicking every time something hurts. It's about recognizing patterns: pain that doesn't change, pain that grows, pain that feels different. That's your cue to investigate. The biggest danger is normalizing chronic discomfort. People often live with pain for years, adjusting their lives around it, not realizing it's their body's constant reminder that something deeper needs attention. When you combine these three early signs: fatigue, unexplained weight loss, and persistent pain, you get a clear picture of a body under stress, a system that's trying to fight something but losing the battle. And the reason so many people miss these signs is that they interpret them as signs of lifestyle, not illness. They blame stress, work, sleep, or age. But the truth is, chronic stress and nutrient deficiencies might trigger the same pathways that allow cancer to grow, so ignoring those signals only strengthens the disease. Your body is designed to maintain balance, what we call homeostasis. When cancer begins to form, that balance is disrupted, your hormones shift, your blood sugar fluctuates, your oxygen levels drop. Fatigue, Pain and weight changes are not random. They're all part of this shift. Your body is working overtime to restore balance, but if you keep pushing through without listening, it can't keep up. Now, what can you do? The first step is observation. Track your energy, your sleep, your weight, and your appetite. Notice changes that last more than a few weeks. The second step is testing. Don't guess, measure. Comprehensive blood panels, liver function tests, and inflammation markers can reveal what's going wrong long before scans or symptoms become severe. And third, start supporting your body's natural defense systems. Focus on foods that reduce inflammation, cruciferous vegetables, omega-3 fats, green tea, and antioxidant-rich fruits. Lower your sugar intake because sugar fuels cancer cells. Improve your sleep because your immune system rebuilds during deep rest. And most importantly, manage your stress because chronic cortisol suppresses immune function, creating an environment where abnormal cells can thrive. Cancer doesn't just attack, it infiltrates slowly, quietly, strategically. But so does awareness. The more aware you are, the stronger your defenses become. Fatigue, weight loss, and pain are not inconveniences. They're messages. They are signs that your body is still fighting, still communicating, still giving you time to act. Every symptom is an opportunity, an invitation to investigate, to heal, and to take control before the disease takes control of you. The fourth major sign your body gives is one of the easiest to recognize, yet one of the most commonly ignored: unusual lumps or swelling. When most people find a lump, their first reaction is fear, but their second reaction is often denial. They say, it's probably nothing, and then they forget about it. But here's the truth. Your body doesn't create random lumps for no reason. A lump, swelling, or hard spot is your body's signal that something abnormal is happening at the cellular level. It could be inflammation, infection, or in some cases, the beginning of tumor growth. A tumor starts when cells begin dividing uncontrollably. Instead of dying off when they're supposed to, they continue multiplying, forming a mass. This mass can feel like a small bump under the skin, or it might grow deeper where you can't easily feel it. Common areas include the neck, armpits, groin, breast tissue, or under the jaw. Some lumps are painless, and that's what makes them dangerous. People tend to ignore what doesn't hurt. Painful lumps often prompt action, but silent ones can go unnoticed for months or even years. If you ever discover a lump that doesn't shrink or change after a few weeks, don't assume it's harmless. Get it checked. Early detection changes everything. Most lumps are benign, cysts, lipomas, or swollen lymph nodes, but you can't tell which is which just by touch. A quick ultrasound or medical exam can rule out the dangerous possibilities before they have a chance to spread. Now, moving to the fifth sign, changes in the skin or moles. Your skin is your body's largest organ. It's a mirror that reflects what's happening internally. When something goes wrong inside, your skin is often the first to show it. The most obvious example is when moles or freckles change shape, color, or size. Melanoma, one of the deadliest forms of cancer, often begins as an ordinary-looking mole that evolves quietly over time. You must watch for what dermatologists call the ABCDE rule. A for asymmetry, one half doesn't match the other. B for border irregularity, see edges are rough or blurred. C for color, shades of brown, black, red, or white in the same mole. D for diameter, larger than 6 µm, and E for evolving, so changes over time. Any of these changes should be a signal to get checked immediately, but skin changes go beyond moles. Unexplained patches of redness, new growths, sores that don't heal, or skin that suddenly becomes itchy, scaly, or darkened, these can also indicate internal imbalances. Certain cancers release chemicals that affect skin cells and blood vessels, leading to discoloration or inflammation. The skin, in this sense, acts like an early alert system, one that's visible and accessible. If your skin starts behaving differently for no clear reason, don't just treat the surface. Look deeper. The sixth sign your body gives is persistent cough or voice change. This one is particularly important because so many people ignore it. They think it's just seasonal allergies, pollution, or a lingering cold. But when a cough lasts more than 3 weeks and doesn't respond to common treatments, that's a red flag. A chronic cough can be linked to lung cancer, throat cancer, or even stomach reflux affecting the esophagus. What's happening here is inflammation. Cancer cells growing in or near the respiratory tract irritate nerves and tissues, triggering a cough reflex. Sometimes the cough is dry, sometimes it's accompanied by mucus or even blood. It may come with chest discomfort, shortness of breath, or a raspy voice. A hoarse voice, especially when it lasts longer than a few weeks, might indicate that something is pressing on the vocal cords or affecting the nerves that control them. Here's what people often overlook. Early lung or throat cancers are usually painless. They don't make you feel sick right away, so it's easy to dismiss them. But if your cough is new, if it's persistent, or if it feels different from your usual pattern, don't ignore it. A simple chest X-ray or CT scan can catch what's invisible to the naked eye. Early detection of respiratory changes can make the difference between a treatable condition and a deadly one. Now, let's connect these three signs: lumps, skin changes, and coughs, because they all share one theme: the body's attempt to communicate visibly and audibly. These are not hidden internal symptoms. These are external messages that your body is almost shouting at you, hoping you'll listen. The problem is we've become so used to noise, work, screens, stress, that we've tuned out our most important signals. A lump doesn't appear to scare you, it appears to alert you. A mole doesn't darken randomly, it changes because something in your internal chemistry has shifted. A persistent cough doesn't mean your body hates you, it means your respiratory system is under pressure and needs attention. If we could just slow down enough to observe these signs instead of rushing past them, countless lives could be saved every single year. You see, cancer is not an invader that suddenly attacks you. It's a process that your own body participates in when its environment becomes toxic or imbalanced. The immune system, your body's defense army, is constantly identifying and destroying abnormal cells. It does this quietly thousands of times a day. But when your immune system becomes weak from poor nutrition, chronic stress, lack of sleep, or exposure to toxins, those abnormal cells begin to escape detection. That's when small clusters start forming, growing silently until they're large enough to cause symptoms like these. So the real goal is not just to notice these signs, but to understand what created them. Why is your immune system struggling? Why is your inflammation high? Why are your cells mutating instead of repairing? When you start asking these questions early, you shift from being reactive to proactive. You move from fear to control. The body's design is remarkable. It always tries to heal first. A lump might start as an immune response, the body encapsulating damaged cells to stop them from spreading. A cough might begin as a way to expel toxins. A mole might darken to protect from UV damage. These are protective mechanisms. It's only when we ignore them for too long that they become dangerous. The bottom line: pay attention to what's visible. Cancer doesn't always hide deep inside. Sometimes it shows itself in plain sight. Your job is to recognize these signs not with fear, but with awareness. Because the earlier you respond, the greater your power to stop what's trying to grow silently. Listening to your body is not paranoia. It's wisdom. It's the kind of awareness that saves lives long before any diagnosis ever appears on paper. The seventh major sign that you must never ignore is unusual bleeding or discharge. This one is perhaps the body's loudest alarm, because bleeding outside of your normal pattern almost always means that something inside needs immediate attention. Whether it's blood in your stool, urine, saliva, or any discharge from reproductive organs, your body is signaling that internal tissue has been damaged, irritated, or invaded. And yet, many people shrug it off. They say, maybe it's just hemorrhoids, or maybe it's a gum infection. But sometimes these small signs point to much deeper problems that, if caught early, can be completely reversed. Let's break this down. If you notice blood in your stool, it might look like dark, tarry material or bright red streaks. Dark stool often means bleeding higher up in the digestive tract, perhaps the stomach or small intestine, while bright red blood usually comes from the colon or rectum. This could be a sign of colon cancer, one of the most preventable yet most deadly cancers in the world. Why? Because it's often ignored. People assume it's just constipation or minor irritation. But when bleeding persists or returns repeatedly, it's your gut asking for help. A colonoscopy might sound intimidating, but it's one of the most powerful tools for early detection and prevention. Then there's blood in urine, even a small trace, even if it appears only once. This might be linked to bladder or kidney cancer. Sometimes people think it's an infection or dehydration, and yes, sometimes it is. But if it happens again, even after antibiotics or treatment, that's when you must act. A simple urinalysis or imaging test can detect early kidney or bladder issues before they progress. Another critical warning is unexplained vaginal bleeding, especially between periods, after sexual intercourse, or after menopause. This is one of the key early warning signs of cervical or uterine cancer. Unfortunately, many women ignore it out of embarrassment or assume it's hormonal. But the body doesn't bleed for no reason. When tissue changes become abnormal, small blood vessels break easily, releasing blood. Early screening, like a pap smear or pelvic exam, can detect precancerous cells long before they turn malignant. Then we have unusual discharge from the mouth, nose, or other openings that looks or smells different than normal. Blood in the saliva could signal throat or lung issues. A metallic taste in the mouth, or persistent sores that don't heal could indicate oral cancer. For men, discharge from the urinary tract that is cloudy, pink, or foul smelling could be a warning of prostate or bladder issues. These may seem like small irritations, but they are your body's way of trying to expel something that doesn't belong. Here's the key point. A bleeding is never just a symptom. It's a mechanism. The body bleeds to alert, to flush out, or to repair. When it happens outside of injury, it's your body waving a red flag. And ignoring it is like turning off the fire alarm while your house is still burning. Now, this is not about living in fear. It's about listening intelligently. One symptom doesn't mean you have cancer, but persistent, unexplained symptoms. The ones that repeat, the ones that don't follow your normal patterns, those are the ones that need to be taken seriously. The human body is remarkably consistent. When something changes drastically, that's data, it's feedback. And the earlier you act on that feedback, the easier it is to heal. Many people wait because they don't want bad news. But here's what they don't realize. Early detection isn't bad news, it's the best news possible. It means you have time. Time to change, time to treat, time to reverse the process. Cancer doesn't grow overnight. By the time it's diagnosed, it may have been developing for years. But if you pay attention to the signals early on, fatigue, pain, lumps, skin changes, weight loss, cough, bleeding, you're not waiting for a crisis, you're preventing one. Your body doesn't want to give up on you. Every single day, your immune system destroys abnormal cells before they have a chance to multiply. But when the signals are ignored, your body starts losing that battle quietly. That's when disease begins to take root. Prevention, therefore, isn't about magic supplements or expensive treatments. It's about awareness, consistency, and connection. The kind of connection where you truly understand what your body is saying. Cancer thrives in silence. It loves ignorance. It grows in the dark, in the spaces where you stop paying attention. But awareness is light. The moment you start noticing patterns, questioning symptoms, and taking small, consistent actions, you shift the power back into your hands. Because here's the truth, cancer doesn't just happen to you. It happens within you. And anything that happens within you can be influenced by you. Through lifestyle, nutrition, stress management, and early action, you can tip the scale in favor of healing. So when your body shows a sign, don't panic, don't ignore, just observe and act. The best medicine begins with observation. Early detection can mean the difference between a short recovery and a lifelong struggle. And most importantly, remember this: your body never betrays you. It's always on your side, always working to protect you, even when you don't notice it. Every symptom is a whisper of truth. Every signal is a chance to respond before it's too late. If you ever see bleeding that doesn't make sense, fatigue that doesn't fade, pain that doesn't end, or weight loss that doesn't fit your lifestyle, stop rationalizing it. Go deeper. Get checked. Take it as your opportunity to take control, because prevention isn't luck, it's awareness, discipline, and timing. And when you catch something early, healing is not only possible, it's powerful. Cancer may grow quietly, but your awareness can speak louder. The moment you decide to listen to your body, truly listen, that's the moment you begin to protect it. And that's how people survive, not by chance, not by fear, but by awareness, consistency, and courage. Because every single life saved from cancer starts the same way, somewhere, decided not to ignore the signs.